This week on Healthy Living, we explore the causes and impact of keloids and what can be done to address this often overlooked skin condition. Dr. Patrick Musinguzi explains the causes of keloids and shares some of the best ways to treat it and prevent it. We will share some advice by experts on how to prevent scars from becoming problematic. We'll have these stories and more in this edition of Healthy Living. Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. Keloids are benign, chronic growth of extra scar tissue that can develop after an injury or inflammation of the skin. It is a common yet often overlooked skin condition affecting millions of people worldwide. Unlike regular scars, keloids continue to grow sometimes years after the initial wound has healed. Although anyone can develop keloids, experts say people with darker skin tones are more prone to this condition, making it a significant issue in African populations. Often misunderstood and untreated, this abnormal growth can have a profound physical and emotional impact on patients.
These are the scars on Kebe's body. He suffers from a condition called keloid, a skin disorder caused because of abnormal wound healing following a skin trauma or inflammation. Kebe says the scars started appearing later in life.
It was as an adult that I saw bumps on my chest. It started to itch, and every time I scratched, the wound would get bigger.
Keloid scars are most common in people of African, Asian, and Hispanic descent, and are 15 times more common in people with darker skin, according to the National Institutes of Health. Dermatologists say it's likely a dysfunction of the wound healing process, and the treatment can extend over several years. In Bamako, such conditions are treated in Simpasante Clinic. Dermatologist Dr. Bakari Sampara explains why the disorder is common among his patients.
We see keloids in consultation. These are often predisposed people. There are often patients who have already had the disease. We've had rates of 1% to 5% of patients who we consult who already have the disease.
Kebe says he's been under treatment for almost 2 years and that other family members also suffer from the disorder.
In my family, there's my sister who has the same disease. She had come from treatment in Bamako. There was improvement and she returned. But I heard that the disease has come back again.
In Mali, dermatologists have been treating keloid using several methods, such as corticosteroids injected into the mass, surgery, and cold treatment, which reduces the risks of recurrence. But Sampara says other treatment options are now beginning to appear.
Laser can be used. It's not much in our country, but it improves the texture of the keloid. There's also chemotherapy, which is a practice we are beginning to know, and which has shown its effectiveness in management.
Keloid scar isn't harmful to the patient's physical health, but it can cause emotional distress, so early detection and treatment can be helpful, according to experts. Another challenge in Mali is tradition. Some liken the scars to a curse, and to avoid facing stigma, patients prefer to get treatment by traditional healers. For Mohamed Danyoko in Bamako, Mali, Philip Alexio, VOA Africa.
We asked the viewers to share their thoughts on keloids and how to better support those who suffer from the skin condition. Here are some reactions from Nigeria.
I don't really know much about it, but I do see it on people. Yeah, I think the people in charge of the medical system should create more awareness to people so that they could help them prevent or treat the disease.
Keloid is not a harmful thing, but if you think you are not comfortable with it, you can go to the nearest doctor or hospital so that you let the doctor know what your problem is. You can see even when you came to us to tell us, not all of us were aware of it. So I think it's not most people that knows about keloid. Some might even know the name and doesn't even know what it signifies.
Keloids, I don't think it can be prevented in some ways. But though that maybe in my own understanding, what causes keloid is that maybe excess protein in the body. You understand? So, but the fact that when you are injured or something like that, you have to prevent so much protein. I think keloid can be cured in that kind of aspect. I think doctor can just have a little stuff. I think there is a particular cream that they can just apply. Most of the time in my place, I think they use honey most of the time to reduce that.
No, I've never heard of it before. Well, I don't think there's enough awareness. If there is, I should have known about it by now.
It's a kind of scar that come out after wound or injury, maybe deep injury or wound. No, people are not that aware about it. They see it as normal something. After your wound, that scar is supposed to be there. Some people see it as normal something. I think they should create awareness for those having it, and those not having it, they should also have awareness about the keloids and all that.
Dr. Patrick Musinguzi is a dermatologist at Mulago National Referral Hospital and the director of the Skin and Sexually Transmitted Disease Unit in Uganda. He explains what keloids are and shares some best practice.
The definition of a keloid is an enlarged scar which has gone beyond the margins of injury, as opposed to enlarged scar which has remained within the limits of the margin, which we call hypertrophied. It is also a scar which has enlarged but not necessarily a keloid, but by and large both of them. But the hypertrophied scar may actually resolve spontaneously, whereas the keloid may not do so. I think the reason may be due to our content, what makes us people of skin of color, and that is the melanin. A scar will remain at the margins of the injury, and if it is a little bit enlarged, we call it has hypertrophied, but within the limits of the injury margins. The difference is this one has grown beyond the margins of the injury. Keloids in the first place are very difficult to successfully or satisfactorily treat. The recommendation is that when the keloid is not so big, we use intralesional steroids to attempt to decompress or reduce its size. When it is a little bit larger, recommendation is that you debulk by surgery, then within 1 or 2 days you follow it up with radiation and sometimes also intralesional steroids. Patients may think that this is, and in a community diagnosis by lay people may think that this is cancer of the skin. Keloids are not cancers of the skin, and literature has it that they rarely become cancerous. They can be managed to a reasonable size by specialists, although it may not be to the real flat of the skin. So my message is that if you have a keloid, your patient out there seek medical advice from the dermatologist or specialist, or any health work would direct you to the right place.
Scars are a natural part of the skin's healing process. Here are some steps experts at US-based Mayo Clinic recommend to prevent or diminish the appearance of scars. Treat wounds as soon as possible. Clean cuts, scrapes, or burns immediately with mild soap and water to reduce the risk of infection, which can worsen scarring. Apply an antibiotic ointment or cream to keep the wound moist and promote faster healing. Cover the area with a bandage, which can protect the skin and speed healing. Avoid picking or scratching. Scabs are part of the body's natural healing process, and disturbing them can delay healing and increase the likelihood of scarring. Once the wound has fully closed, gently massaging the area can help reduce the formation of a thick or raised scar. If the injury is deep or the wound is large, it is best to seek medical attention. Stitches or special adhesive strips can help hold the skin together and reduce the risk of scarring. With the UN Decade for Healthy Aging, the United Nations is helming a global collaboration on healthy aging from 2021 to 2030. During this decade, the World Health Organization, along with other UN organizations, will address sustainable ways to improve the quality of life of older people, their families, and their communities. In Africa, where the population of seniors is growing rapidly, efforts to promote healthy aging are both a challenge and an opportunity for advancement of elder care. For more insight, we spoke with Dr. Salem Aklilu, CEO of First Chiropractic Clinic in Addis Ababa, Ethiopia.
A lot of decades, aging has not been the forefront of healthcare, but it is the most important aspect of, especially for our continental resources, to have our nation to be a healthy aging. This is the only body we have from the beginning to the end. And how well are we taking care of it? And healthy aging should start really from young kids from schools. Kids would be taught to be body aware, so they move, they think, and they eat, and they speak, and they drink enough water to have a healthy aging. I would say a 15-year-old, what are you eating? What are you drinking? How much are you sleeping? And how much noise do you have in your ear? You know, those are the things that have to be aware. Every single thing that we put in our mouth is affecting who we are and who we are becoming. So how much sugar? Sugar is killing us. Sugar is killing us. For the longest time, it hasn't been really public to be talked about. But literally, the more sugar we eat, the more poison we're taking. Did you know that our body reverses aging if we pay attention, if we eat right? Oh, if we move right. The movement doesn't have to be really big. It could be simple movements, but it can be every day. Small movements every day. Eating right, drinking a lot of water, resting. Even after 65, a person taking their health seriously can reverse the aging by 20 years biologically. If we really be wise to use our resources, our human resources, by keeping a healthy nation, I think that will make us the richest. I would say in the government level to make kids be aware of their body, take care of their body, and so the burden of disease is not going to be really crippling the economy of the nation. So how do we teach our children to move right, eat right, think right from childhood? So when we go into the seniors, what we have now is still work into the wellness arena to make people say, you know what, the body heals itself if we can teach people to take care of themselves. That would be an investment. At the beginning, it's a cost, but it would pay tremendously by having a much more healthier nation.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linochmudu. Until next time, stay well and strive to make every day a healthy day.